Healthcare workers in Newfoundland and Labrador say they are at a breaking point with major staffing shortages in long-term care due to COVID-19. Jerry Earle is the president of the Newfoundland and Labrador Association of Public and Private Employees and said one healthcare worker reportedly worked 12-hour shifts for 17 days in a row. That just demonstrates the severity of the situation. Jerry is joining us this morning from St. John's. Good to meet you.
Good morning. Thank you for having me on.
Earlier this month, nearly 800 healthcare workers, most in long-term care, were off due to COVID-19. So what is the situation right now?
The situation is less a little bit, Anne-Marie. Probably we have about 600 across the province now of Newfoundland Labrador that's off between our long-term care and acute care facilities, and still having a significant impact on the delivery of care, especially in long-term care facilities.
Yeah, with major staffing shortages in long-term care homes, how is it affecting the level of care when you talk about shortages?
It's absolutely affecting the level of care and those that provide the care, and more importantly, the residents on the receiving end. We had a shortage of healthcare workers, LPNs, personal care attendants, and other health professionals before we went into this pandemic, and unfortunately, it wasn't addressed by our government and the regional health authorities there. So what we find ourselves now, facilities that are extremely challenged, struggling. I've had calls on weekends where I've LPNs and PCAs on the phone crying, basically because they could not deliver the level of care that's necessary in the facilities, because we were quite fortunate through this pandemic. But this last wave, we have not been. Significant levels of positive cases amongst residents and the staff. Like I just mentioned in the preamble, LPNs, PCAs working 12, 17 days consecutive. That's unfortunately become the norm, not sustainable, not acceptable, and it's the residents of these facilities that are suffering the consequences.
Mr. Earle, as a way of maybe demonstrating what it's like in the long-term care homes and this crisis that's going on, what kinds of things aren't getting done?
Basic personal care, where people have to try to struggle to make sure residents are fed. You got to remember, in the long-term care facilities in Newfoundland Labrador, this is level 3, level 4, the highest level of care that's required of residents, and they were short-staffed before the pandemic. I'm hearing from facilities, just a recent facility close by here, St. John's, where they unfortunately had 2 residents. Condolences out to those families. The LPNs were and the PCAs extremely upset that they could not spend the time with those residents that were actually passing away in their facility, and that has an impact on the residents and the staff that work in these facilities. They have to try to live with this because they're there to provide these vital services, these important services. But when you can't provide the basic services on some days, that is extremely concerning, and it could have been avoided before the pandemic. And it has to be addressed because there were, I'm sure we share the shortages right across the country in some other provinces such as Ontario and Alberta. I'm hearing as well a shortage of healthcare workers. It's really pronounced there in Newfoundland Labrador and was failed to be addressed during the pandemic. We're making efforts now to address it long term, but right now we are in a crisis in our healthcare system in our province.
Yeah, those healthcare workers that you described are now being told not to expect a break or any annual leave. What action needs to be taken?
What action needs to be taken? First of all, listen to frontline workers. I repeatedly say that here in Newfoundland Labrador. The people that know best are those that are delivering these vital services, and they're never listened to. They were telling the previous administration and this administration they had insufficient numbers. They need to be listened to. We have working groups set up now, but unfortunately it's a little bit late for the current situation that we're in because just enrollment numbers were down in some of our colleges, so it's extremely concerning. The situation, we're hoping that the numbers continue to decrease of those that are absent from the workplace. Like I just mentioned, we have people that can't get a day off. On their days off, they're being mandated to work. And that's why they're getting into these consecutive shifts. So can you imagine an healthcare worker that's in their 12th or 14th consecutive 12-hour or 16-hour shift, or after working 24 hours caring for your loved one, the level of care that they can provide and the mental and physical injury they're bringing onto themselves.
Jerry Earle, we're going to have to leave it there, but hopefully interviews like this help to get the message out there. Thank you so much.
Thank you so much for the opportunity.
Hey, thanks for watching. If you liked this, be sure to subscribe here, or you can check out more Your Morning videos right here.